Well, she's chronically on steroids. She's immunocompromised. So we still have to think about simple things like infection, whether that be a bacterial infection, whether it be a viral infection. It seems to have been flu season all year this year. So I'd probably be doing a swab to look for things like flu or COVID. So there's some infectious stuff that's got to be up there. If the patient doesn't really have much of a cough or fever, maybe I'm pushing away from that. Pulmonary embolism, I think, has to be considered. Usually you hear clear lungs with PE, but if this patient has an underlying lung disorder, then you're not really going to get that benign exam of the lungs when you listen. So PE has to be in there. I guess you could consider things like, could this patient have a pneumothorax? Like they have COPD, they popped a bleb, and now they have a pneumothorax. I think that's up there. Even though the patient has no cardiac history, we want an EKG, make sure that we're not missing something like an MI. I'd probably start with that stuff, while again, we're trying to get a little bit more information about what this underlying lung disease is.